In general, also, you see compliance by people down, COVID fatigue, it's the holidays, the vaccine is coming, I'm just tired of dealing with it. And government enforcement is down. One of the more troubling points in the data is the RT is up 1.3. We haven't spoken about this in a while. RT is the rate of transmission. 1.3 means one person will infect 1.3 additional people. Once that number is over 1, you're in a problematic state. And this is a problematic situation. So we want to calibrate to the new material, the new facts, the new data. The criteria, the metrics we use: what is the positivity rate? What is the hospitalization rate? What is the hospital capacity in that area? You don't want to overwhelm the hospitals. Considering the RT rate, what is the density and what is the crowding? Which is a factor we have not been considering because the RT was below 1 for some period of time. And then the risk level of that economic activity, going back to the chart that shows where the cases are coming from. So you're calibrating the risk level of the economic activity, the density level, the RT rate, and the hospitalization rate and the positivity rate. A red zone is New York on pause. It is stop all but essential services and business. It's where we were. We don't have any red zones in the state. We don't want to go back to a red zone. Other states have gone back to closure. We don't want to go here. The only reason you would close the economy is because you're going to overwhelm the hospitals. And if you get to 90% of hospital capacity, then you are effectively at the point where you're going to overwhelm the capacity. And capacity here includes staffing, equipment, et cetera. If we see that we're on a glide path towards overwhelming the hospitals, you have no choice but to close down the economy. You cannot overwhelm the hospital system. Short of that is an orange zone, which is 4% positivity over 10 days, or you're at 85% of hospital capacity, or the rate of growth in the hospitalizations is dramatic as determined by Department of Health. Yellow zone is 3% positivity, and you are one of the highest percentage growth clusters in the state in terms of hospitalization. We're calculating the data of this week and this weekend, and by those metrics, any new zones will announce on Monday. If you are a yellow zone or if you are an orange zone, this is all determined on the facts, and what it is saying is, in your community, you have a problem. It's not somewhere else. It's your community. It's your grocery store. It's your church. It's your temple. It's your mosque. It's your block. And you can make a difference in your community. And it means you have to take it seriously. Yes, I'm tired, and I've been doing this for a long time. I feel it myself. I get it. But we can't relax until COVID relaxes. And COVID is not relaxing. We have the vaccine. We're going to beat it. But we have to finish the game, and we have to finish the war. And we don't want to lose people who we don't need to lose. God will take people. We're not going to stop death. But we should make sure we're doing everything we can to protect every life that we can. And that's the goal of all of us going through this. Staten Island, 26 deaths on Staten Island. Staten Island is 25% of all the deaths in New York City, even though they're only 5% of the population. Staten Island has one of the highest growth hospitalization rates in the state today. And these are deaths, 26 people. You know, we talk about number statistics. You have to remember, behind every statistic, every number is a family, is a father, is a mother, is someone who's going to go through the holidays with a lost loved one. You know, for me, I feel it. I have the conversations. I talk to the families. It's painful. And we need people to understand that to the extent it is preventable, we really must prevent it. This is not a political issue. There is no politics to the guidance or these rules. It's the one issue that both the Trump team and the Biden team agrees with. The rules that we follow are basically CDC rules. That's the Trump administration. And the Biden advisors are saying the same thing. So there is no politics to this. I have no politics in this. I represent every person in the state of New York. I don't care what party you are, what ideology, whether you're short, you're tall. I don't care your sexual orientation. It makes no difference to me. These are rules that make sense for everyone, and it is basically all common sense. This is not high science we're applying here. These are common sense rules. Where the virus is highest, then you have to take action. We're also changing rules for the hospitals in the state. We've already announced that all hospitals have to do a 25% increase in staffed beds. Hospitals must remain under 85%. They can remain under 85% capacity by either adding an additional up to 25% of beds, or reducing elective surgeries, or both. They have that flexibility, but we want every hospital to remain under 85% occupancy. Over 85%, that hospital is now in a critical situation. As we said, 90% triggers a red zone, and every hospital has to have a 90-day PPE supply. The increasing RT is a problem, rate of transmission. It's more of a problem in the most dense areas. We learned this lesson in the spring the hard way. New York Times, the pandemic is particularly devastating to America's biggest cities as the virus has found fertile ground in the density that is otherwise prized. Yes, the density, which is the asset of the cities, becomes a liability. The crowding is a problem. CDC last week did a caution on indoor dining. In New York City, you put the CDC caution on indoor dining together with the rate of transmission and the density and the crowding, that is a bad situation. The hospitalizations have continued to increase in New York City. We said that we would watch it. If the hospital rate didn't stabilize, we would close indoor dining. It has not. We're going to close indoor dining in New York City on Monday. Outdoor dining and takeout continues. Outside of New York City and in the orange zones, we're going to watch the indoor dining data. The numbers are down in the chart. But we're going to watch over this weekend, and we'll make any adjustments next week if the data suggests. Federal government must provide relief to these bars and restaurants in this next package. I understand battling COVID. I also understand you're wiping out businesses. We'll do what we can in New York. We're going to extend the commercial eviction moratorium. So if a business can't pay the rent, because of this situation, they won't be evicted. In gyms and salons, as you also see, they are not the problem that they were. We have restrictions. The restrictions made a difference. We're going to allow them to operate in orange zones with reduced capacity and additional testing. They're at 33% now. Capacity will go to 25%. They do biweekly testing. It would be weekly testing, but they can operate in an orange zone. The winter plan I went through with Dr. Fauci I did it publicly at a briefing. He was very kind to give me a lot of time to talk it through privately. And we're planning basically December, January. Everyone is expecting, Dr. Fauci expects, Dr. Redfield expects, the CDC director, that you're going to see a bad December, a bad January. We understand that. How bad is the question? We hope that you'll see a stabilization mid to late January. Why? Because Thanksgiving started. We may be seeing the tail end of the Thanksgiving surge, if you will, but we're about to walk into the Hanukkah surge and the Christmas surge and the Christmas week surge and the Kwanzaa surge and New Year's Eve and New Year's Day. And by the time that tails off, you're talking mid to late January. When does it end? It ends when the vaccine hits a critical mass. That could be June, it could be September. But between today and June, that is a long 6 months. And we can't get complacent, well, the vaccine is here, everything is fine. That's not the reality. We've only been at this for 9, 10 months. We have another 6 months to go. If the facts change, we will adjust to the facts. We're going to look at the data over this weekend for determinations of zones. We'll look at it for indoor dining. We'll look at it for all those categories that we were seeing on the chart. Facts change, opinions change. Facts change, we adjust to the facts, and we'll continue to do that. What's the optimal goal? To remain one of the lowest spreads in the nation. The tide is coming up. The boats are going to go up. You're not going to stop the tide. But you can do as much as you can. And this state has one of the lowest infection rates in the United States of America. Our highest infection rate in the state is lower than 40 states. Our highest infection rate is lower than 40 states. So God bless the people of New York, because this state, with its density, with its diversity, is really doing an extraordinary job. And we have to continue to do it because we determine our future, right? We determine the curve. Last point is the vaccine. That is the weapon that ends the war. We're going to need a public education campaign to battle skepticism. We have to hit 75 to 85% of the population for the vaccine to be effective. We have 50% of the population saying they won't take the vaccine. That's a problem. We have to outreach to the black, brown, poor communities. That's basic social justice. That has been overlooked. I'll speak to that in a moment. And we have to have the most aggressive distribution administration program, and we're starting that right now. Good news is the 170,000 doses from Pfizer that we announced should be here imminently, Sunday or Monday. We also will get 346,000 doses of Moderna on top of the 170,000, and they'll be here the week of December 21. So the vaccine is coming, and we're ready to administer it. Part of the vaccination has to be the fairness of the vaccination process. I believe during COVID, many inequities were disclosed. Healthcare disparities were disclosed. That's why the death rate for blacks is twice what it is for whites. That's why the death rate for Latinos is 1.5 times what it is for whites. We have to learn from that and correct it when it comes to the vaccine. I don't believe this HHS administration has provided for a fair distribution to black communities and brown communities and poor communities and rural communities and Native American communities across the state. I think they're basically leaving it to the private sector. They haven't given the states any resources to do anything else. We sent a letter to Secretary Azar, who is the political head of HHS. 110 leaders signed on from the state saying that don't continue the discrimination that we have seen through COVID, where black, brown, and poor communities were left behind with higher death rates, higher infection rates. COVID doesn't discriminate, neither should the United States of America. And we're all anxious to do the vaccine. Let's do the vaccine fairly. Let's do it justly. New York State is going to make sure that it makes that point loud and clear, because we're not going to allow this federal administration to proceed with a plan that leaves out certain communities, and the communities that actually need the vaccine most will get it least. That would be the cruelest irony and an added injustice. I believe to leave out those communities is illegal, is unconstitutional, and is discriminatory by effect, if not intent. And I believe this administration knows that. I believe the incoming administration of President Biden will correct it, but we don't want this administration program to start discriminating against people, and we're going to start sending out the vaccine. Let's make sure we send it out fairly with the first vaccine. That's our goal. And we're joined by some special guests today. It's a pleasure to have them.